What if your heart suddenly stopped, while you were surrounded by nothing but open ocean? No traffic, no nearby hospital, no ambulance racing toward you, just miles of water in every direction. Would anyone reach you in time? And here's the part most travelers don't realize. Modern cruise ships are equipped to handle cardiac emergencies in ways that surprise even first responders. But in those first critical minutes, what actually happens can determine everything. Before you sail, this is something you deserve to understand. Most people step onto a cruise ship believing they're leaving hospitals and emergencies far behind. Out at sea, the nearest city can be hours away, and that quiet distance can make a simple question feel unsettling. If something serious happens here, how fast can help truly arrive? It's easy to imagine being isolated, waiting, hoping help comes in time. But what many travelers never realize is that cruise ships prepare for medical crises long before passengers ever board. With trained response teams, emergency protocols, and equipment designed for the moments that matter most. Still, preparation and reality are not always the same thing. When symptoms begin, when every minute matters, and when you're surrounded by open water instead of city streets, what actually happens in those first critical minutes may surprise you. The moment symptoms hit, every second counts. Crew members trained for emergencies move instantly. But what does that look like in reality? Alarms sound. A specialized medical team springs into action, moving through hallways with a precision most passengers never notice. They arrive within minutes, carrying life-saving tools designed to stabilize a heart in distress. Here's what surprises many. What they do first depends on your exact symptoms, your location on the ship, and how quickly help is alerted. One wrong assumption, or even a few delayed moments, can change everything. Imagine clutching your chest while the ship hums around you. The crew is racing, but will they reach you in time? And the first critical minutes? They may be far different than anything you imagined. Step inside the ship's medical center, and you might expect a small clinic. But the reality can shock you. Some cruise ships carry equipment almost like a mini hospital. Heart monitors, defibrillators, oxygen tanks, and emergency medications, all ready at a moment's notice. Doctors and nurses on board are trained specifically for sea emergencies, handling everything from sudden heart issues to more complex conditions. What many travelers don't realize: stabilization often begins immediately, right where you are. Crew members can perform life-saving procedures in your cabin, sometimes in ways that would surprise even seasoned travelers. Even with all this preparation, the decisions crew members make in those first critical minutes can be far more surprising than anyone expects. And that process, what happens next, can mean the difference between a terrifying emergency and a story of survival. Sometimes stabilization on board isn't enough. When your condition worsens, the crew must make critical decisions, fast. That could mean diverting the ship to the nearest port, even if it delays everyone else's vacation. In extreme cases, a medical evacuation helicopter may be called, descending onto the deck while every second counts. Weather, distance, sea conditions. Every factor can change how quickly help arrives. Imagine lying on your cabin bed, chest tight, watching rotor blades churn the ocean spray as the crew works around you. Every decision in these moments balances safety, speed, and survival. What surprises most travelers is how coordinated the process is, yet how unpredictable it can feel. Even the order in which patients are evacuated or treated can shock passengers who never imagined a cruise emergency could unfold this way. Many travelers assume that once the medical team takes over, everything is covered. But the reality can be shocking. Emergency treatment at sea is expensive. Medications, procedures, helicopter evacuations, even port diversions can add up fast. Insurance is another surprise. Some policies cover cruise emergencies fully. Others leave gaps that could cost thousands. Imagine lying in the ship's medical center, heart still racing, relieved to be alive, only to realize the bill for your care could run into tens of thousands. Even seasoned travelers are stunned by how quickly costs can climb, a hidden truth most only learn the hard way. Carrying proper documentation, choosing insurance that explicitly covers cruise emergencies, and understanding your policy isn't just smart, it can protect both your life and your peace of mind. Let your doctor know your travel plans. Carry all medications in an easy-to-access bag. Document your medical history for the ship's team. Choose a cabin near elevators or the medical center if mobility matters. Even with precautions, emergencies can happen, but knowing exactly how the crew will respond gives you the confidence to relax and enjoy every moment at sea. Thousands of travelers sail safely every year, enjoying open decks, calm seas, and the freedom to explore. But here's the part most passengers never realize. Many only fully discover the ship's hidden life-saving systems when they're on deck, watching every second matter. Being prepared doesn't just protect you, it lets you truly enjoy the cruise and survive the unexpected.